All right. Well, here we are.
We're back.
And,
Where are we today?
We're at Priority One Urgent Care.
Yes.
In the X-ray room.
Yes.
So,
welcome.
So we're gonna. So it's sort of spring-esque. We've had
according to the calendar, it's
decent weather, sort of some days.
Right. What happens every spring?
Text each other when we get our first tick bite. I call it tick injury, tick illness, tick bite.
First tick of the year.
Yours was March 11th.
Yep, we pulled our first tick on March 11th, actually.
So today's March 26th, 25th. I think ours was the 24th, the 23rd maybe. I think it was Monday. You know, it was this week. We had somebody call and send us a picture of a nasty wound. So, yeah, why are ticks a big deal?
Well, I mean, to other ticks, they're probably okay. But for us, they seem to be a problem because they tend to spread a lot of disease. And that's kind of the big thing for us, right?
So everybody's always, I'm worried about Lyme disease, I like get nauseous hearing about Lyme disease, mostly because there are some other pretty nasty tick-borne illnesses.
There's a lot of them out there, actually. Yeah, we check for them here, a fair number of them, not all of them, here at the practice. I'm sure you do too. In fact, your practice probably even more so, right? In terms of where you're located. Although honestly, we're in the Pine Bush. It's all kind of Columbia County, the Pine Bush. It's kind of ground zero for Lyme disease and tick-borne illnesses. So yeah, there's a whole bunch of them out there, and they do present in somewhat different ways.
So the big three, as we say, the ones we typically check for.
Yeah. So what do you like? Lyme, anaplasma, and you like either Ehrlichia or Babesia to round it out.
Or both. Usually, anaplasma and Ehrlichia are kind of like synonymous.
Yeah, I think the public health people kind of lump anaplasma and Ehrlichia together.
Yeah.
So Babesia was never big, but we assayed for it. But in the last few years, we've seen a significant increase in that.
Yeah, and so I used to check. I got bit by a tick. Boom, let's check for this, and then talked to one of the infectious disease docs who said, you really shouldn't bother checking it was the titer, it was the IgM titer, and he told me you're gonna get a lot of false positives.
For Babesia?
Well, yeah, because you're always going to be positive on the titer type of thing. So if you have a Babesia, you want to trend it. But, to just randomly check for Babesia, he said, unless you have, an anemia, thrombocytopenia, which is a low platelet count, he really kind of discouraged it, or neutropenic, low white count.
Well, I mean, I think that our assay is our approach is a little bit different. I mean, for sure, Lyme titer testing. You never go with a Lyme screen. That's a high false positive rate. And you need a Western blot for
even with the Western blot, that takes about sometimes 3 to 6 weeks to get it turned positive.
It shouldn't be. Oh, turn positive.
Yeah.
On the IgM, remember your Western blots need IgM and IgG.
Correct.
So IgM should show within a couple of weeks. But
that 2 to 3 weeks.
The more I talk about Lyme, forget about Babesia. We're talking about Lyme.
Yeah.
When we're talking about Lyme, the more variation there is, because I've seen people who've come in, with a fresh bite, only a few days old, who've got erythema migrans and, had a positive IgM, which is like, okay. Now, I guess my default for that always is you got bit by one that you found. The one that you find doesn't probably cause the problem because you take it off. It's the one that you never found that caused the problem. And maybe you had one 2 weeks earlier you didn't know about.
Well, and people all talk, I found one in my arm. I didn't have any other. Well, not like me. Most people have a full head of hair. And anybody who's seen a tick, I mean, they're tiny. You get the little midges and stuff, which can spread disease. Good luck finding it in your mustache, your scalp. Typically, they like the groin.
And we found them in
dark places, behind the
place.
knee.
Yeah. Every place you can think of. Some you can't. We find ticks.
Yeah. So, so I always tell people that all the time too. Okay, good. You found one. Kind of like talking about prophylactic antibiotics for Lyme. So, I'm sure you guys give it, prescribe it.
Just in terms of that, plus in terms of how we test, we can do point of care, rapid Lyme testing, but the test isn't good because once again, what you're looking for is a negative because it has a high false positive rate. You don't want to see a positive because it doesn't really tell you anything. If you get a positive, then you must send blood work to know. But most patients
you have a rapid Lyme here.
We don't. We stopped doing it because it wasn't really worth. A patient sees a positive test result, and their answer is, "I have Lyme." The answer is, you very well may
probably had Lyme.
No, you very well may not. That screen is not sensitive to this problem. You got it. So what you're looking for is a negative test. If you get a negative test, great, it's negative, right? But if it's positive, it still could be negative until you get the confirmatory test.
Yeah.
So that's problematic for us. So we tend to be like, yeah, if we're concerned about it, just send the blood and don't react to a screening result that's positive. React to a positive Western blot.
So if you're worried about it, send the blood. But a healthy person comes in, fatigue, joint pain, they hike in the pine bush, they play, their kid plays baseball. They're a 13-year-old
Right.
who
Right.
plays soccer and runs in the grass to get a soccer
Sure.
ball. Fatigue, joint, just feeling achy, maybe a low-grade fever, headache. How long do you wait on labs, or do you treat?
I probably do both. Is what I do, because if I send, if we send the full panel,
Mhm.
that could take more than a week to come back in total. The
You can
Lyme
be pretty
testing,
sick. You can be
right.
really sick.
The Lyme testing is pretty fast in isolation, but the whole panel can take a while. So if there's someone that's got a great story clinically, or better yet, they just have erythema migrans. They got a 12
make it
centimeter
easy.
flat, painless, not
Yeah.
itchy, round rash,
Mhm.
right? I don't even test that. I just treat that.
Mhm.
This part of the world, this time of year, they just get treated, right?
Sure. Yep.
If they come in sick, like you're describing, and we've assessed them to say, well, is this some other source of illness?
Well, and you have to differentiate.
right. There's
The
a lot of
the
things.
Anaplasma ehrlichia is less important than the Babesia because Babesia doesn't respond to doxy.
Right. Very, very
And
true.
co-infection, which
also,
is more than one.
The ID guys will refer to Lyme as the summer flu.
Sure.
When flu ends, Lyme starts on the
Mhm.
timetable almost. And of course, there's the subtle differences with flu. You're probably coughing. With Lyme, you're not, but you feel like you have the flu.
Yeah.
If that makes sense.
Yeah.
But I'll probably, to answer your question, I have a very low threshold to start people on treatment while I'm at least waiting for the results.
Yeah.
And one of the ways you know about anaplasma, frankly, you give a couple of doses of doxycycline. And
Yeah.
like
Lyme's pretty similar too. Whereas going back to Babesia, which is the one we kind of, like the dark cloud, if you will, ways you kind of start to sniff for that is, known tick bite or fever, chills, etc., joint pain, but no rash, and didn't respond to doxy.
Mm.
And the question is, do you have Babesia, which, last year I probably saw a handful of cases.
But you know what? We didn't see any for decades.
No, maybe one a year, and then it's
kind
of around. So
I would say before 4 years ago, I could count on one hand how many I saw my whole career.
Oh yeah, in Columbia kind of seen a lot, more than that, but definitely more prevalent. And again, the things you really got to kind of start to be suspicious is they don't respond to doxy, low white count, anemia, low platelet count. Those are kind of the big.
Yeah, well, if you get
things.
the blood, I mean, honestly, one of my things is we'll send a basic blood count and chemistry because we'll get that back the next day. And oftentimes for anaplasma, for example, you'll see elevated liver enzymes.
Yep.
You'll see that thrombocytopenia, low platelet count, and you're like, and it's the story. You're like, hey, you got to have that.
I had a guy last year, late 70s, early 80s, came in. He came in on a Tuesday and quite sick, fever, chills, thought maybe he had pneumonia, thought maybe he had a UTI. It was in spring, summertime. I think it was probably June. Any exposure to ticks? No. Any tick bites? No. You've been outside doing yard work? No. And I was like, gosh.
You got a dog that goes outside?
This sounds, kind of Lyme-esque. And long story short, didn't treat him for Lyme. 2 days. This is a Tuesday, Thursday. He came in. I sent off all the labs. Thursday he came in. Fever's not better. Nauseous. Now he's reporting a cough. Lungs are clear. So I treated him for pneumonia. Winds up getting hospitalized Thursday night. Quite ill. Friday I get his PCR back for Babesia. He was in St. Pete's. I called, hey, the gentleman in bed, such and such. He's got and he's positive for Babesia. 36 hours later, he's feeling great and on it at home.
Yeah,
so
it's amazing.
Kind of cool.
Practice of medicine is definitely an interesting pursuit. It's a practice.
Yeah.
We always continuously practice, don't we? So yeah.
So I'm trying to think of the other. So when do you worry about Lyme, tick bite stuff?
When you worry, in what sense?
Like,
you got loads of people coming for bites, not loads of people coming in sick with the bites.
When do you get concerned? Like, oh shit, is this more than Lyme?
You mean co-infections?
Co-infections or more systemic illness?
Like secondary Lyme or tertiary Lyme?
Yeah.
Great question.
I had a guy, Dart. Do you remember a few years ago? We had a guy. He was a baseball coach out in Skodak and called actually got a hold of Dar. He's like, I just don't feel it. I got really bad headaches, really family history of migraines, really bad headaches, and came into the office and he looked very uncomfortable. Like Lyme neuralgia. He actually had like nuchal rigidity, which is so basically he had the Lyme had infiltrated into his spinal canal. And when he bent his neck, he had shooting pain. And I never met the guy before he came in the office, and he's like, "Yeah, I kind of have this rash too." And he pulled up his shirt, and he had Lyme erythema migraines kind of all over.
That's funny because you wouldn't think you'd get your meningitis on primary Lyme, which is what the rash.
He had it for weeks,
because often the rash comes and goes.
He was quite sick from it. I tried to advise him to go to the hospital for IV Doxy, and he was a country boy who was like,
it wouldn't be IV Doxy, it would be IV.
Well, he got better on Doxy, but it took quite a few doses. He was on it for 3 weeks. Yeah.
I would say one similar oddball. People say urgent care. Do you handle like emergencies? And the answer is no. We're an urgent care center, not an emergency department. But I do look so we don't do like things like CPR and things like that here. Knock on wood. But years ago in the old place,
not by choice, you don't.
Right? but it doesn't come in. But years ago in the old place, I recall we had to ventilate some person with a bag valve mask device while waiting for the paramedics to arrive because this person was profoundly bradycardic. So what do you think their problem was? They were bradycardic from their slow heart rate, and their blood pressure was down. They weren't breathing much.
I would think a lot of things. MI would be,
but they had tertiary Lyme.
Oh, yeah. So when the Lyme actually gets the myocardium, the heart, and it basically infects the heart.
Yeah, exactly. Which you don't fix that with medicines to speed the heart up. You fix it with antibiotics to kill the Lyme. That's kind of one of those things. Like what comes into urgent care for high acuity, somebody with tertiary Lyme, not somebody with having an MI.
Yeah.
Interestingly enough. So do we see co-infections? Yeah, you get those people who test positive for a couple things that have like bad bite or bitten by several different insects.
Have you seen Rocky Mountain spotted fever?
I've tested for it. I don't think I've ever seen it.
Yeah, we've had some cases of it out by us.
Have you?
Yeah.
Well, that's great to hear.
another vector-borne illness.
Yeah, tick-borne illness.
The good news is it responds to
doxycycline.
So
So we have a big bottle of it here. Plus, we even have the IV stuff here because we're just so
we
invested in treating that.
We have the oral stuff here, and also our patients. Like we had somebody come in this week for a new patient visit, kind of physical. Hey, kind of head to toe. Oh, and by the way, I work in the woods. Do you think I should have Doxy on home?
Yeah, might as well.
Doxy on hand at home, yeah. So he left with a script for 20 pills and kind of like, hey, you get bit. Yep. These are CDC guidelines. Take this if you're not feeling better. Any issues, give us a call. But I always see people kind of sometimes will fret. Oh, should I take the antibiotics? And risk benefit, risk of Lyme, risk of 1 dose of Doxy, benefit of 1 dose of Doxy.
Right. Well, I don't know how much true science lies behind that prophylactic dose of doxycycline, but from the CDC guideline.
When it came out like probably 15 years ago, they said, if it's given in the appropriate time frame, it could minimize the risk of Lyme by about 80%. Mm-hmm.
So we do it. I believe
and
it.
I will say most people who call and get the prophylaxis, we don't wind up seeing them for Lyme disease.
Right.
Again, we don't do hard clinical trials on it.
Right. No. And I hate that there are some practices out there who will give someone a prescription to go to the pharmacy to get 2 tablets of doxycycline. We just keep it here. It's part of the visit. You come in with a story. Here's a couple tablets.
Yeah,
it's all done.
We prescribe for people to have at home. If somebody comes in with a tick bite, it's kind of like here.
And I have heard this. You correct me if I'm wrong, but this may be more legend than fact. But in Columbia County, primary care typically will have a Lyme titer as part of your annual blood work for screening exams.
No, again to the conversation earlier. I go back and forth on that because if your Lyme Western blot was positive last year, there's a good chance it's going to be positive this year.
Right. It's probably more legend than
that. Being said, it's also kind of good to watch them because if your IgG, or if your IgG, you had 6 out of 10 IgG bands positive in 2024, and then in 2025 you had 2, and now here you are and you have 7 positive. Have you had a recent reinfection?
I guess to get the clinical story at that point.
And that's exactly, we have a couple of people who we watch it on, but I don't as a rule of thumb because some people I just feel like it's just gonna stimulate anxiety.
So you're not going to get a Lyme titer routinely as part of your annual physical.
If people,
at least not from him.
I never say no. Let me put it that way. I never tell anybody no.
I've heard that about you.
Yeah, that's the person that'll end up with really bad, end up being really sick. And
Sure.
hey, you didn't do my line titer.
Right.
I picked this up.
That
I've
is
never
not
seen
for
this.
your eyebrows or your nose.
That's what I was actually thinking for my nose. So
Yeah.
what is it and what's it for?
So this is actually a forceps. We call it, in the vernacular would be tweezers, but we call them forceps in healthcare, right? And this is specific for pulling ticks off people. So it's this little guy with a spring activated device that that I'm dropping. I just broke. No, I'm kidding. You can't break it. Thank you, sir. And it opens up like this, right? And it grabs the tick, clamps down on the tick, and then you very slowly. What I like about this is I'm a believer in the unscrewing the corkscrew theory.
Yeah,
the
that's
proboscis.
Yeah.
So you kind of grab the tick. I don't know if we can show this or not.
Take a walk in the pine bush. Come back 20
I'll
minutes
come back
later.
in 20
You
minutes.
can probably
You pick it up with a little bit of distraction, and then you just rotate it in a counterclockwise fashion, and just holding very gentle pressure on it will pop the tick off whole. It leaves no mouth parts behind, no nothing. Very non-traumatic, very gentle.
So I tell people, if you have tweezers at home, basically do the same thing with tweezers. Grab it and try to.
Yeah, if you can do it, if you have the dexterity to do that. Some people can't, but.
And it's in an area you can grab it.
Reach, right?
Not in your scalp, your groin, your back.
Maybe you would do that, but
I could try. So what happens when you break part of the tick off, as we all do when we're learning how to pull ticks off before we've pulled out several hundred?
A lot of folks come in because of that problem, where they've taken it off at home and there's some residual part, and they get very concerned about that, which is fine, but it's not going to transmit illness to you. It might be annoying to you to know that there's something left, but your body does a great job. It considers it a foreign body. It's going to what they call wall it off, or form a little tiny scab or pustule around it in the skin. And in a week or two, it's going to fall off in the shower. It's going to be gone. We used to spend a lot of time back in the good old days, like when we used to work in the ER, fishing out mouth parts and doing a lot more damage in the process.
Cutting people
we cut them open to get this thing out. And the answer is it's just going to come out. But some people are really uncomfortable with it, and we'll take maybe not that force if we'd use something like a Kelly clamp, but something like that to really get a good grip on it, and then just sort of work it out gently. Try hard not to damage.
But this also goes along with like the infectious process, right? So you have a foreign body from an animal, a tick, an insect left in you. Yeah. It does increase your risk for a localized skin infection, which is a cellulitis.
Correct.
So anytime you get a tick bite, or really any animal insect, you're always at even bee stings, hornets. There is some degree of potential, to break in the skin. The purpose of the skin is to form a natural barrier. There is always a risk for skin infection, cutaneous infection. They're called cellulitis. So it's not always the line. People will come in with a tick bite and this bright red kind of leg.
You're absolutely
and it's
right.
not erythema migrans, it's cellulitis.
Right. And that's, we see that. And honestly, it's much more localized. So the hard part is if you're seeing a rash, I think that the local health departments characterize the rash as being greater than 5 centimeters in diameter, right time of year kind of thing. It's probably erythema migrans, should be treated accordingly. Usually what we'll see is a bite site and maybe a 2 or 3 centimeter surrounding area of redness or erythema. And we'll say, that's probably some tick bite cellulitis. Now, like Ryan says, the cellulitis is a function of you break the integrity of the skin, the barrier, and the bacteria. There's bacteria that lives on your skin. Doesn't matter how much you wash, it's supposed to be there. If you break the surface integrity of the skin, the bacteria can get into the skin where it doesn't belong and set up that localized low-grade infection. And that can happen because of the bite, because of poor technique removing it, or from both.
Yes.
So, we see that. So I often will say, well, you know what? Instead of the single dose prophylaxis doxy, I'm going to give you 7 days worth to treat the cellulitis, which will also prophylax you. I still might say, here's a prescription for a test to take in a month to make sure there was no conversion from the bite. But, we'll be fairly aggressive about treating
and that's what I tell people
localized cellulitis.
You live in central upstate New York.
I'm muted here. Hold on. Can you still hear me, Dara? All right.
You live in upstate New York. It's between the months of March and November. December, January, March through February. You had a tick bite. You have some redness. Could be erythema migrans, could be cellulitis. Are you allergic to doxy? No, that's probably the drug of choice. I'm going on vacation next week somewhere in the sun. maybe we use augmentin because amoxicillin does cover.
Absolutely, sure. Or just sunblock, put your sunblock.
That's the other. But again, you have people who are allergic to doxy. So then,
Yeah.
But I would.
Well, I think Lyme, as that bacteria itself is a pretty from a virulent standpoint. It's susceptible to a lot of meds.
It is, but it's not susceptible to like Keflex or Cephalexin, which is one of the first line therapies for a benign cellulitis.
I'm going to have to check on that.
Non-complicated cellulitis. Keflex is one of the first line.
There's a lot of things you can give to cover Lyme. We just traditionally used doxycycline because in the 1970s, when it was figured out, that's what they used. That's in the literature. That's what we use. But you can cover for a lot of things.
It's third line.
What's third line?
The cephalosporins are third line, like ceftriaxone in particular. Keflex doesn't have Cephalexin.
They want
doesn't
have
an indication. They want doxy, amox, cephalosporin.
Yeah. So. But I think you treat it with Bactrim personally, but I don't know. So
that's another drug. We could have a whole separate talk about that.
But there's things there's things out there you can use, and certainly little babies getting doxycycline is an issue, right?
Why is that though?
I don't know. People think there's a problem with teeth and bones.
Yeah, but 7 days of doxy in a pediatric is probably okay. Acne treatments, 6 months, 10 months is not what you want. But I've told family members with when my kids were in the 6 to 14 age, I'm like, just give them 7 days of doxy.
Are your kids still in the 6 to 14 age?
They're almost out of it.
Wow.
Their attitudes are way out of it.
Of course.
So I'm trying to see. Dara makes a little cheat sheet for us. So any myths you could think of? What about chronic Lyme, or do we not even want to open that can of worms?
I don't know. I mean, there's a lot. I don't know enough about that to comment. Certainly, we see a number of people who have that diagnosis and have been treated for that. I don't know what the state of the art is or the state of the science is on that right now. You probably run into that more than I do.
Justin Timberlake, it must be real.
Where do you get it from?
Untreated Lyme. What's one of the big concerns with? There's lots of concern with Lyme. Tertiary Lyme, Lyme carditis, Lyme neuritis,
Lyme arthritis.
So Lyme arthritis. So my perception of chronic Lyme is Lyme disease that has settled in the joints, caused an arthritic condition, and every now and then, as any type of arthritis, whether it's osteoarthritis, rheumatoid psoriatic, you get a flare up. Does that mean that it's actually the bacteria of Lyme causing the flare-up?
That's the living bacteria.
Or is it just that you had some damage to your joint, you've irritated it, how is that treated? There's a lot of literature. One thing I kind of always go back to, guess what? The insurance company will not cover, intravenous long-term treatment for chronic Lyme, which means that there's some, factual data lacking.
Right. I mean, we'll probably see folks who will say, "Wow, I was treated in the past for chronic Lyme for a number of years. I've been good for a number of years, but now I feel like I have it again." That may not be arthritis; it may be fatigue, malaise, fever, that kind of thing.
Those people, I typically say, "Okay, you're tired, you're exhausted. Let's do labs. Make sure you're not anemic."
Right.
That being said, you live in Woodstock, you live in Chatham. It's spring,
might
summer,
have
you're
it
out in
again.
the woods. There's a pretty good chance you
You're
got
going
bit
to
again.
get it again, right? As we have to say, you might be a tick magnet, right?
So, and that's true too. We don't understand that, but there are some people, walk near the brush, come out with ticks on them.
Yeah.
I spend a ton of time in the woods. I've been bit, like 5 times my whole life.
There might be a reason for that.
Yeah. Well.
One
Anyway.
of the myths is blood type.
Oh yeah, yes, more blood type.
Oh, no, that one.
They prefer a certain blood type, which is why certain people get more ticks on them.
Yeah, I'm sure that's not.
I had people years ago, again, this is going back 15 years, Columbia County, a guy who was doing his own study, he was eating just a ton of garlic because he heard that ticks don't like, the guy stunk like garlic. And I was like, maybe you're right, because quite honestly, I don't want to be near you right now.
Well, as I started off, I say, it's probably not the tick that you found that's causing the trouble. It's the tick you never saw.
And
they get on you, they eat, and they leave.
As I sort of alluded to earlier in the conversation, do you have to go in the woods?
No. Where do I live? Delmar, right?
Yeah.
If I don't keep my grass cut this short and I walk out with bare feet in the lawn,
or to your point,
they are on me.
You have a pet and
pet goes out, brings it. Do you remember? I don't know if you remember this, but again, years ago in the old place, we had a person come in who we couldn't figure out what was going on with their story. They lived on Morton Avenue, downtown Albany. It was February.
Mm-hmm.
They tested positive for Lyme. Ultimately on the workup, we went through every differential on this person. Tried that. I was like, "Where'd you get that?" And they're like, "I had no idea." I was like,
It happens.
I don't know. It happens. You never say never in this business, correct?
Well, ain't that the truth? What What about, do you have a percentage of, we've kind of like circled around this, what percentage of people actually develop a bullseye rash?
I wouldn't know because I don't see everybody to know, but we get a lot of people coming in, not necessarily a bullseye rash, but a rash. I think when you mentioned erythema multiforme, just like
Widespread.
I was camping in Greene County a week and a half ago, and I've got all, what's that? That's.
But I would
where I go with
comfortably say that greater than 60% of people with Lyme or tick-borne illness do not present with a rash.
Or they had a rash they never saw because the rash is transient.
Correct.
And it's in a place they never looked.
Correct.
It's not an obvious place. So they may have it. We just don't know. They don't know. It's like the rash comes for 3 days and goes, and it's painless. It doesn't itch. It's not raised. It's just this funky thing. And also, is it located where the bite occurred?
Yeah, that's a great point.
It's almost never is where
the bite.
The bite was here, and the rash is here.
Maybe you got a second tick there. You never know about.
Never know that second tick. The second tick theory. It sounds like a thing from JFK or something.
All right, what else we got on Dora's?
Don't be reading so obviously. Come on, try hard not to stare. You need new glasses. Guy needs new glasses.
No, I think we're good. Prevention. Oh. Yes.
Don't go out. No, it doesn't work.
Don't leave. Well, even that. Yeah. Don't leave the house. And don't let your pet leave.
Right.
Even the pets with the. I have
pets.
our dog gets that.
Yeah?
Every 3 months.
Does that work?
Tick prevention. The ticks die on her. They still bite her, but they're dead, so they can't transmit it. But last year, her and I both got anaplasma.
Yeah, I remember that.
And so now I'm doing, and I talked to our vet about it.
You said you were walking in the woods and they don't touch you. You said.
I said I got bit 5 times in my life. Last spring being one of them. That was the only time I've ever had a tick-borne illness. But I mean, I spent I'll come out of the woods. My father will be covered in ticks. I remember one year. You could appreciate this. We were having dinner. And it was a Sunday dinner, and I picked my head up. He had a tick crawling down his forehead. Now, he had come over for Sunday dinner. Little did he know he was going to end up helping me track a deer through the woods. So in his penny loafers, you can imagine how good of spirits he was in. So
he loved every minute of it.
Probably, but he will never admit it. Anyway, back to prevention. Yes, there's lots of things you can do. People say wear bright colors. I don't know that helps as much. Certainly tucking your pants into the socks.
Long sleeves, long pants.
Long pants.
Spraying all the stuff on.
The spray, I use this stuff called Ranger Ready. Totally no endorsement. I forget the name of it. We put it on the website if you were on Facebook a few weeks ago. It's been great for me. I use it on the kids. Again, particularly when the kids were younger, I would spray, particularly Owen when we went in.
Didn't precipitate seizures in them and all that stuff? 10,000% deep.
Maybe that's where we went wrong. Yeah. But then the big one that everybody knows is the permethrin, right?
Yeah.
I have people who soak their clothes in permethrin. One thing is you don't want permethrin on your skin.
Yeah.
It's not particularly a good chemical.
I soak my clothes.
Yes, that actually, and I know people, actually I know a summer camp who was having a big issue with tick bites, and they had, it's Hudson Valley Pest Control. They have an organic tick spray, and they come in.
Are we doing an endorsement again?
We're not doing. The guy I use out by me.
What are you doing?
Yeah, I mean, I don't know anybody else. Google tick spray.
Google spray my yard for ticks.
But no, this guy, they use organic stuff, and I forget the name. I think it was some kind of
like deer urine or something.
No,
like
it was a plant-based oil.
You guys all use deer urine out there for everything?
Different things.
Okay. How do you get the deer urine, by the way? I'm just curious.
That's a whole separate episode.
Okay.
That's a whole separate.
That's a fall episode.
Yeah. No, but anyway, they can come out and spray. It's plant-based oil, and they can explain it to you, but the ticks don't like it. I have had patients. I had one patient a couple of years ago who kept getting bit, and she's like, "What can we do? What can we do?" Because her and her husband were getting ticks. I said,
move to Arizona.
I don't know, but move to Arizona is one option. Or I said, this is a company. I know they've done other work in the community. They didn't have any more tick problems.
Right.
So. Well, I'm sure it's not cheap. I mean, they're spraying a yard.
It's not science, but it's good.
Yeah, and again, it's not it's not $7, but if you have a couple acres and every time you go out, your dog's coming with ticks.
No, I hear that. I mean, honestly, where we live, surrounded by woods, loads of deer, and I used to go out all the time years ago, and I don't anymore. I just
No, it's becoming an issue, and last year was miserable again because before last year I had never really had much of an issue, and all of a sudden, and people say they wish like this winter because we got so much snow, the ticks were insulated, whereas even though it was cold, snow was insulating them. Yeah. If we didn't have all the snow, but we had the cold, we would have a better spring for ticks. It's going to be a bad spring. It's going to be some years it's a wet spring. Some years it's a wet spring. Some years I don't think there's any rhyme or reason.
I don't either.
At the end of the day,
when it hits about mid 40s and it's wet out, they come alive. That's why March and November, I think, are our biggest tick bite months. But people aren't sick from it until about May. That's when people come in sick from those bites they got in March and April.
You can get some chickens to eat the ticks.
Yeah, actually,
that's a good
people, and that's another thing. People always ask me how, how my kids and I are. I'm like, both neighbors had chickens and ducks.
Really?
Maybe that has something to do with it.
Oh,
I don't know.
That's good.
This is interesting. There is a new Lyme vaccine in the works. So it's in, what did you say, second phase, third phase?
Oh, really?
But there was a Lyme. Do you remember the old Lyme vaccine?
I don't.
It's like in the 90s, there was a Lyme vaccine. I only really know about it because going back to like the early mid 2005 to 2010, I drew a Lyme titer on somebody and I'm like, dude, every band, IgG, IgM is positive. He's like, oh yeah, I got that vaccine a few years ago and they told me I would always be positive. So I was like, oh, great.
No kidding.
Well, this is fun. Now you have a tick bite Lyme symptoms and this blood work is useless.
Yeah, got to be a doctor. Got to practice medicine.
So we, there's been people like that. And again, people who have a positive IgG and chronically positive IgM, the answer is treat the symptoms, right? Don't wait for the blood. I think that's the biggest thing is some people are, and I respectfully so I call it antibiotic phobic, where they're like, I really don't want to take this stuff. I get it, but like you and I have seen, once you see people who are seriously ill from tick-borne illness, I think that changes your mind.
Yeah, I would say, a lot of the people we see come to urgent care. I mean, remember, it's a little bit different animals who go to primary care, especially your primary care, because they're really invested in their health and what you offer from a plan standpoint and from a health maintenance standpoint. So it's a little bit different. Folks come here, they probably have a thought in mind that they want some treatment as opposed to not want treatment.
Or want your input. They've already consulted the Google.
Yeah, well, they definitely want, mostly they want the input. They usually want the input. But there's probably more of a slight skewing towards wanting some kind of treatment, and it's not always indicated. Obviously, we have those conversations, but if it's questionably indicated, one of the hard parts about doing an urgent care practice is we may not ever see these patients again. One and done. So we're going to probably err on the side of caution, meaning over treatment in air quotes here, where you can say to somebody, hey, listen, let's follow this over the next few weeks. Come back on Thursday. I'll check you again. That kind of a thing. It's a different kind of a perspective and a different approach when it comes to that aspect of it, the treatment aspect of it. But in terms of the prevention stuff, I don't know. It is what it is.
Lots
it's a fact of life in this part of the world.
It's just kind of a work in progress.
Yeah, you live in the Pine Bush and you come in with this thing. I'm like, here's your stuff. Pretty much.
So we had EHD a few years ago, epizootic hemorrhagic disease, which killed off like 80% of the deer population in Columbia County, Rensselaer County. It was a pretty big thing, right? Like I'm waiting for the epizootic.
Was that tick-borne?
Actually, it was insect-borne. It was on the midges. So
really?
Yeah. Oh, it was a big deal. It was a big deal. I am optimistic the tick community will suffer the same. Will
transmit. Well, I mean, you have some of the other.
There's got to be
Powassan virus.
Oh, Jesus.
Right.
Yeah.
I mean, these are like
Ebola.
Newer. Well, that's not tick-borne, but I mean,
but it's
newer generation
transmitted. Yeah.
Illnesses, and it's like, what do we do with that? What do you do? Do people bring you ticks?
Oh, that's $1 million question, because that used to be a big thing too.
Yeah, we still get people bringing their ticks in. I'm like, that's a tick.
We do, and actually, but that being said, sometimes it's a dog tick, which we haven't really touched on. There's your dog tick, there's your deer tick, there's your Lone Star tick.
That's the one, right?
And for
Powassan virus.
Powassan, is that the same as
the Lone Star tick?
No, what's the one where you can't eat alpha gall?
The who?
Oh yeah, no, we have some people. This is a new thing. Sorry, Dar, I know you told us to keep it to 3 diseases, but alpha gall syndrome. I had somebody it can only be transmitted by a Lone Star tick.
How do you spell it?
ALPHA -gall GAL syndrome. Basically, what happens is you develop antibodies and you cannot consume red meat any future. You have a vast systemic systemic mastocytosis. You have this, histamine, wide histamine release.
Yeah.
If you get this and you're exposed to the protein in red meat, and you literally will pass out, and the only treatment is an EpiPen.
No kidding.
So, and there was like 2 cases of it in Columbia County.
We don't want that
last year. No, that one is. I would take Lyme or Anaplasma or BB over that, because that's never going away.
Yeah.
Wow. So,
all right.
Powassan virus though.
Yeah, I mean, awful from what I've read about it. I've never seen it to my knowledge.
That one I haven't seen, but just going backwards real quick on the ticks. So we don't ship ticks out like 20 years ago. That was like a thing, right? Now I don't
there's
even
still
know
labs that people send their ticks to, and you'll
Yeah.
get someone will come in and saying the tick that bit me was positive for the disease
that you already treated me for.
Well, or can I be treated for the disease? I'm like, well, the tick was sick, but are you sick? Is my answer.
Yeah. So just going backwards, sometimes the tick, it doesn't hurt to bring the tick in again because it's a dog tick. It can, I don't think they can carry the best
cellulitis.
Similar.
Right.
Deer ticks obviously, carry everything. But then if you have a Lone Star ticks don't carry. I don't believe they can carry Lyme. So it's interesting to kind of, and you just put those under actually Eric Bello. Shout out to Eric Bello showed me this because we had somebody bring one in once and he had his magnifying glass and he said, "Look at that." So
wow.
Yeah.
I don't know. Well, you're getting outside of my realm at this point. I think we're a little bit above my pay grade here.
Yeah. So anyway, I think we're good.
Do we have to do any kind of like acknowledgments here? Like, where's your office? What's the name of your practice?
Well, we're my Marshall Health.
There you go.
We're Marshall Health.
Located
out
where?
in Ghent. And,
beautiful downtown Ghent, New
direct
York.
primary care practice. Give us a call. Shoot us an email. So,
what's your phone number at the office?
518-732-1800.
Great. Where are we here?
Well, it says it right there on your name tag. You zoom in on the mug or the name pad.
The mug of the mug.
No, yeah.
Priority 1 Urgent Care.
Priority 1 Urgent Care.
28 Western Avenue, Gilbert, New York.
Just
518-867-8040.
And just a few miles down from Crossgates and everywhere. Yeah,
Costco.
Oh yeah, that's going to be big.
Huge, right? Yeah. Yep.
We'll catch up in about a month or so.
Yeah, what do you want to talk about then? Who knows?
Some summertime.
No,
it'll still be spring.
Want to go fishing? We go fishing.
I would love to go fishing.
We can talk about fishing. Not fishing, actually, but just talk about it. So.
Oh, we can talk about removing fish hooks injuries.
Ooh,
I'll bring a treble hook in, and I can demonstrate on you.
I bet I got some here.
Yeah,
previously used.
Mosquitoes, yeah, no, and but seriously, fish hook injuries are something you and I have encountered many a time.
Yeah, many times.
How many times do you pull them out?
Yeah.
Push them through.
Anything they want.
Yeah.
Your son had one last year.
My son? Your son?
No, your son.
My son.
You guys had the same son?
Not that I know of. Owen had one last year?
Yeah, we were trying to do a video call for Denise Cousins.
No, I think it was. Where did he get hooked?
He was fishing with his friend.
Happens.
Yeah, I don't
Occupational hazard.
Yeah. Yeah, well.
Of course. Like, the apple doesn't fall far, but the answer is you play with fire, you're going to get burnt.
Yeah, well,
All right.
better than hunt an accident, so.
See ya.